Research ought to and can enhance consumer choice, power, and knowledge. This video captures the efforts, beginning in 1998, of mental health researchers, consumers, and federal administrators involved in a research project committed to realizing the promise of a rigorous study of outcomes of consumer-operated programs run by and for people with serious mental illness. My name is Jean Campbell, and I am a partisan to that effort. As a mental health consumer, researcher, and principal investigator of the Coordinating Center for this study. 30 years ago, with the deinstitutionalization of people locked away in psychiatric hospitals and the concomitant prejudice and discrimination that they experience in communities, people with mental illness responded by developing programs of self-help and peer support in order to provide mutual support and to advocate for civil rights. Over the past decade, these programs have matured, diversified, and increased in numbers throughout the United States. Today, in a time of shrinking public mental health services, the partnerships of consumer providers and traditional providers has the potential to expand the capacity of the mental health system and to meet the express needs of people with serious mental illness and to fulfill their dreams of recovery. The COST Multi-Site Research Initiative is a federally funded 4-year randomized control study of the cost effectiveness of consumer-operated programs when offered to people with serious mental illness as an adjunct to their traditional mental health services. This project was designed as a collaboration of study sites in Maine, Connecticut, Pennsylvania, Florida, and California, Missouri, Illinois, and Tennessee, a coordinating center at the Program for Consumer Studies and Training at the Missouri Institute of Mental Health, and the Center for Mental Health Services in the Substance Abuse and Mental Health Services Administration. Our commitment to this initiative is fueled by an impulse to break the bonds of tradition and to empower people whose lives are circumscribed by the work of scientists to become collaborators in the production of knowledge and in the application of scientific evidence for mental health practice. When the streams of talk are gathered together, many hard truths are revealed. The individual voices produce a resounding chorus that tells of many perspectives of mental health services and research, different for different people and powerfully different from the reality that now holds sway. Ultimately, the COST Multi-Site Research Initiative will test the proposition that it is at the level of people truly communicating with each other, with mutuality and respect, that human values have the greatest potential for being incorporated into the public and private spaces of society and for finding home in the niches of our individual psyches.
I'm a consumer researcher from Portland, Maine. I work at the University of Southern Maine in the Edmund S. Muskie School of Public Service.
I'm the University of Chicago, working with GROW for the next 4 years on this Consumer Operated Services grant.
I'm Mark Salzer. I'm a professor at the University of Pennsylvania Center for Mental Health Policy and Services Research, and I'm the lead evaluator on the evaluation of Friends Connection.
I'm Diane Cote, and I'm the executive director of the Peer Center Incorporated in Fort Lauderdale, Florida.
I'm executive director of the Mental Health Association of Southeastern Pennsylvania and one of the sites for the Consumer Operated Service Research Project. We're doing the Friends Connection program.
My name is Jean Risman. I'm from Portland, Maine, and here is a consumer representative for the project in Portland.
My name is Jaime Delgado. I reside in Chicago, Illinois, and I work for the University of Illinois.
My name is Laura Van Tosh. and I am a consumer of mental health services and an ex-patient of publicly funded mental health services. I've been involved in the consumer movement now for almost 20 years.
What is consumer self-help, and why is it important for us to study?
The critical parts of self-help and the philosophy of self-help really is about understanding what another person has to say and understanding what another person might need in order to further their recovery. I think that's the basis for self-help, and to be able to participate in a self-help environment where no one is either threatened or kind of pathologized in terms of their illness or the symptoms of their illness is something unique to the self-help movement. And I think related to that also is the whole notion of providing mutual support, where two people who have come from maybe a similar background are able to share and understand from that basis information, education, advocacy skills in an atmosphere really between two people, and also within a larger project, for example, in an atmosphere where folks feel like they are autonomous, that they're respected, that there's some sense of dignity being provided to one another, and really an atmosphere of honesty and understanding.
The idea behind self-help and peer services is that you meet other consumers and learn for yourself how to take care of your needs. And the problem with the term self-help is it sort of suggests this rugged individualism when you're on your own, sort of caring for yourself, as opposed to what I hope we find from GROW. What I've learned from GROW so far is more of this mutual help program. It's sort of this community they've built within a community right now that isn't accepting of persons with mental illness. The community they built, the sharing and caring group that really provides ongoing services, doesn't catch it, ongoing support, ongoing caring, ongoing personal touch.
The philosophy of peer support is probably helping other people like yourself without judgment and without diagnosing and without labeling, with empathy and understanding, because you've been there yourself.
I believe that the people who know best what they need, I believe that people know best what they need, and that other people who have been in the same, who are and have been in the same kinds of circumstances are the most capable of understanding the needs of similar people. So consumers relate well to other consumers because they understand what they've been through, and that it simply makes sense to have the people who are the experts providing the services.
What are our hopes for this project?
I think one of my big hopes is that I have a long background in psychiatry and know quite a bit about how to help persons overcome their symptoms, improve their social skills. And I once had a consumer tell me that, you know, not having any symptoms and not having any social skills doesn't mean you have a good quality of life, doesn't mean you have any sense of power. And so I actually spent the last couple of years sort of scurrying around trying to figure out what that would take. So I think one of the things I really want to see and show is how these kind of mutual help programs really add something significant to the community support program system that's not there by the current system.
So I'm really excited about being able to get in touch with groups of consumers and talk about what do they think about recovery and what does it mean to them and how can we measure it. And I think it's going to be a real exciting experience to do that.
Some of the barriers that do exist between researchers and consumers who are running community-based programs begin to fall down, that the barriers begin to get penetrated, that people will be able to kind of work at a round table as opposed to a boardroom sort of table where there are people at the head and people sort of in the back. And that's actually stems from my roots in the movement, really, that at one point I was in the back of the room and now I actually sit side by side with professional researchers having an opportunity to participate.
Maybe my overarching hope is that by the time this project is over with and the results are in, that the effectiveness of consumer-operated services will be widely recognized, and the second-class status of consumer-operated services will be a thing of the past.
What do we want to learn?
I'm perfectly certain that what are the active ingredients in peer-supported services are not the active ingredients that I've provided in professionally run services. So what are those active ingredients and how do they connect closely to success?
One of the important things about being a consumer researcher is that you bring a whole different perspective. And you also begin to understand the perspectives of other consumers, whether or not they're researchers. And you value and you encompass all those various perspectives and begin to educate the community to those various values. And through your research, you can do that. And you can also then begin to educate consumers about research.
I've been doing it for so long that I intuitively know that the work we do is good, and that there is a positive potential outcome. And I think what we're doing now is sort of, proving what people sort of know. I mean, we're using scientific evidence to be able to confirm, I think, something it just makes common sense, of the idea that peer support, that people helping each other in a non-hierarchical manner, or at least hierarchical manner possible, breaking down some of the barriers from the helper to the helpee, all that to me just makes common sense. And I think good science just comes out of proving something that makes common sense.
What are our fears and how do we transcend them?
Maybe a fear would be that we don't find anything, that we don't find the differences that we might expect. Again, I'll think in terms of probability and think that that's low. I also think that we're all a very creative bunch, and that if it came to that, we would find something. If we don't find it with quantitative measures, we'll find it elsewhere. We know that these kinds of interventions are successful, are positive.
When we first put this together, we went and met GROW, about 9 months ago. And, I suppose the one that really had the most fears up front were them, because here come these academics, how we might write about them, how might we take them out of the closet sort of thing. I guess the fear I might have whenever I'm looking at any service is I didn't come up with a good enough design to pick up what it is they're doing, because they clearly seem to be doing something well. We just want to make sure we're talented enough to find out what that is.
First of all, it will have some effect on who we are and what we do, and change it in some way. I'm concerned that researchers may be a little more powerful in some way than the consumer groups, and then things will go according to a researcher's view and philosophy rather than the consumer-run program's philosophy. And this GFA was to research the effectiveness of consumer-run programs and I don't want that to be diluted by researchers who see this as an opportunity and don't quite understand the consumer-run end of things. It's really exciting to be part of this and learn about research, because I really feel that this is the only way we can prove consumer-run programs are valuable and cost-effective and effective. And this, in turn, hopefully will end up with funding coming to many more projects.
How do we plan to work together?
I guess the first thing that pops into my head is a partnership, equal partnership. You know, I tend to be pretty egalitarian in my views on a lot of things, on ways that I do things, and that's really how I see the collaboration, is we all come together with different things. For example, in our site, I come with a certain perspective and way, and I have a certain set of knowledge that, and the other people, the, program service providers, the executive director who just showed up of Mental Health Association, I mean, all of us have different experiences, different skills, different set of knowledge that we can share. So
it's not necessarily consumers on one side and professionals on the other. There are a lot of professionals who are consumers as well, and consumers who are professionals as well. And I certainly believe in the role and the place of professionals in mental health services. But it just makes no sense to have a system in which the people who provide the service don't know anything about what it's like to be a consumer of services. With all the different sites and the different kinds of services and the people from different fields and different experiences involved, there's going to have to be a lot of sharing and a lot of listening and a lot of open-mindedness if this is going to be successful. And I think that I can't help but learn from that kind of, to be able to listen and listen to other people's point of views, and hopefully to be able to see different ways of doing things that may be either equally as effective or effective in different ways, so that it will eliminate a kind of provincialism, I hope.
It's important to, first of all, look at what are all the commonalities that we have and build off those commonalities, but understand that there are individual characteristics also, that there's a difference between individualism and individuality, and I think that there are issues of individuality as groupings of people. Certainly there is a different experience that women go through. There's a different experience that people of color that go through. There's a different experience as someone who has been diagnosed with a mental health illness that really in many cases will bond us together, because we will feel different levels of oppression and different issues of stigma that affect us all, and sometimes I have found that we unite more on those levels and are able to even act on those levels more than on where it considered some of the traditional things that separate us, whether it's on the question of color or even gender. I feel very motivated in helping to build some of the bridges that need to be built among different sectors of the population. I think there's like a greater good that can come out of this, which is every time we make the effort to work together, whether we succeed or we fail, we learn something from it. And I think that I see this as another opportunity to succeed or fail, and therefore learn and improve. So, personally, I want to roll up my sleeves, and I really want to dig into as many things as I could get involved in, and even some of the issues here that someone might think is remote to my specific role as diversity and cultural trainer. I don't see myself in that narrow role. I see myself in the broader role of helping to make this work.
How do we say goodbye?
I like the leaning against the wall approach. I like that. Publication will be further on down the line.
They frisked me just to get in the building.